My name's Kathy Maupin. I'm an MD. I trained at the University of Missouri, and my specialty is OBGYN. My subspecialty is hormones in the menopause. Therefore, I've been asked to give you a lecture on the menopausal changes and pre-changes that women go through between the ages of 40 and 55. These changes are something that most of my patients come in and are very frustrated about because they haven't understood why they are feeling so bad and they're only 40 or they're only 45, and they think that they should still feel young and they should still feel vibrant, and the changes are not explained to us by the press or by anyone else. So we're very lost at this stage. People think that we are crazy or lazy or that we've lost our energy or have some other illness. So when they come to me, my biggest job is to explain the hormonal imbalances that begin in our 40s and that their symptoms are a normal aging change. We were meant to live to about the age of 50. Most mammals don't live beyond the age of reproducing, and we do. Therefore, when we were created, and after the fall, of course, we lost our ability to live forever, and we then began living until, at the most, 40 to 50. We could then create children until we were in our 40s. But God, being who He is, had us protect ourselves from having children that we couldn't live to take care of. Therefore, we lost our testosterone and lose it still around the age of 40 to 45. That decreases our sex drive, therefore decreases our wanting to create children before we go through menopause. Men, of course, have a little later decrease in their testosterone. Therefore, they can then reproduce children with yet another wife if we were just living to 50. Now, this is a problem now that we live to be 100. We've learned to live longer, but not better. So my job is to help us live better as long as we can live. So what I do is explain first the testosterone drops, which means our testosterone controls our energy, our well-being, our self-esteem, our thin body type, our muscle mass. It also controls our libido and how we look at our husbands. Testosterone itself is one of those things that if you don't have it, you look at your husband and go, what are you doing here? I mean, I'm married to you, but and I know I still love you, but why are you still here? And that was so that we didn't create children we couldn't take care of late in our lives. So having said that, we now have this, and it creates a lot of havoc in our marriages. One of the things I do is try to replace testosterone early in the 40s to people who have these symptoms so that they can enjoy their marriages. In fact, my pastor sends me patients or couples who have failed counseling, and they come in so that they can have their hormones checked to make sure that their hormone levels are good, and then they go on to something else to see what's going on with their marriage. So having said that, the testosterone is the first thing to go. So the second thing to go for women is our progesterone, and that's when we notice that our periods are getting very irregular and heavy or light, or we can't even expect them at a certain time. So when we have our periods 21 days apart and then 40 days apart, and then they're very heavy, we go to see our doctors. Sometimes the treatment is to place patients on the pill, which will make them regular and will stop this lack of progesterone, and that is exactly what happens. We stop ovulating every month and we don't produce progesterone. So when that happens, the pill does override that and can keep us going until we're 50, and if we're great on the pill, that's the first line of treatment. Another treatment would be to give the patient, to give you the progesterone that you're missing. So if a patient doesn't want birth control pills or had a bad experience or has had blood clots or heart disease, we choose something else, and that is some type of progesterone. The progesterone that we choose when we're treating women with progesterone deficit or anovulation, meaning no ovulation, is prometrium, which is a now FDA-approved progesterone, which is a natural progesterone mixed in peanut oil. This is given either daily to stop bleeding or day 14 through 28 so that you can treat both the emotional symptoms of PMS and the bleeding and other symptoms of PMS like headaches. We can also choose a natural progesterone like sublingual under the tongue or vaginal progesterone, which can be mixed in a compounding pharmacy. This is far closer to what your body made, and it's a better delivery system because it looks to your body just like what your ovary used to make. Therefore, your body doesn't have so many side effects. When choosing hormones, I choose, if possible, a non-oral type of delivery system because it looks to your body like something that's what they made. And when that happens, your body's much happier, much healthier, and much more balanced. This type of progesterone is a little hard to find. There are several pharmacies in St. Louis and around the country that make compounded progesterone. It is by far my first choice. If you need this type of thing, you can choose Prometrium, which is easier and covered by insurance, and every pharmacy takes it or has it and can deliver it to you. Or you can choose to go to a compounding pharmacy for your progesterone. Now, this is something that not every doctor offers, but they know about it, and if you want to ask them about it, you can choose that. This is all for infrequent or no ovulation that causes bleeding problems in PMS. So as you remember, the first thing to go in our 40s is testosterone, the second is progesterone, and then the third is usually long after the progesterone starts dropping, and that is in fact menopause. One of the big myths is before menopause that your estrogen just drops and drops and drops. It doesn't. It surges. It gets higher and higher, which makes us miserable. It gives us breast tenderness. It makes us swell. It gives us abdominal swelling and cramping, and it makes us bleed more. It also makes fibroids grow, which causes us to have surgery, when if this didn't happen, we wouldn't have to have surgery for fibroids. To suppress the estrogen, that sometimes helps our fibroids, sometimes it does not. Many of the things that we fear in our 40s, like breast cancer or uterine cancer or even surgery of any type, is caused by too much estradiol, which is the ovary just giving it one last surge before it gives up. Now, when the ovary gives up, then we have lost all three of our hormones. And we have lost our estradiol, and we begin having the hot flashes, which everyone considers menopause. The definition of menopause is that it is the time in our lives after we have had 1 year without periods. Or, if you've had your ovaries removed, it's immediate. If you've had your ovaries removed, that's when menopause begins. And it lasts the rest of our lives. So it's something we have to get used to and learn how to live in it. And very few of us are so well balanced or gifted genetically that we don't have some side effect from menopause. Now, once you get to that stage, then you have to replace the estradiol. Estradiol is something not to be feared. The WHI study that came out in 2002 was really a bad study. It was done on people who were quite old, who had never used estrogen ever, and had never had a hot flash, which means they picked a population that in general were more obese, had more diabetes, and in general were higher risk for heart disease and stroke. I'm not sure why this government study did that, but it skewed the results and it made everyone fearful. And there were 2,500 studies or more before that with estradiol of all kinds, and that never caused more breast cancer, never caused more heart disease, never caused any more strokes. In fact, it made heart disease better. Therefore, the way they did the study freaked out every American woman, and you can't imagine the phone calls that came through my office. I mean, I had people crying and screaming, and when they'd been off their hormones 2 or 3 days, it was an acute or a fast stoppage, and they were in shock, and they're emotionally unbalanced, they were medically imbalanced, and they were so upset. I had to save some of the phone calls just because I had to remind myself how bad that study was and what it did to my patients. And I had to bury my anger and try to treat them and promise them that going back on their hormones was not going to cause them to have breast cancer. In fact, breast cancer is one of the things that we fear the most, but it's not one of the things that kills us the most. It's one of the most treatable things that actually we encounter. Therefore, when choosing to take hormones or not, that should not be led by fear. That should be led by health. It's much more dangerous not to take hormones in your menopause than it is to take them. And breast cancer, if you get your mammogram yearly, we find it, and we find it early, and it's treatable. Therefore, I suggest that if you have symptoms, you should treat them and live a full life, and that you should disregard the fear that we have had instilled in us by one study that was done poorly. Now, once you have found your way to your doctor and you have then asked them for hormones, I have to tell you that not every doctor thinks as I do, or has read the study, or has even thought about the fact that so many other studies were done, and so many other studies confirm that it makes us healthier and not sicker. So you may have to convince your physician to replace your hormones, and if they won't, you'll have to find someone else to take care of you, because you should work with your physician. It should be a team effort, and it should be something that makes you feel good about working together with your physician for your health, and not just something where you go to your physician because you're sick. I promise you that you'll be sicker if you don't use preventive care and use diet, exercise, hormones, and anything else you can use to be healthier. It may not make you live a day longer, but God already knows how long we're going to live. So but it definitely will make us live better. And I think that that's in His will. And I think that that is something that He wants us to tell you. I feel that that's one of my goals and one of my callings, is to listen for what He wants to tell me to tell you. And He wants us to be healthy as we can be. So in looking at hormones, we've talked about testosterone, progesterone, and estradiol. If you have a choice about what type of estradiol, that would be as natural as possible and as non-oral as possible. My first choice for my patients is to give them a patch that has both estradiol and progesterone in it. It's easy, it works, transdermal systems don't have as many side effects, and don't go through the liver and make all kinds of other things that we don't need. Therefore, if you have a choice, the patch would be my first choice for FDA-approved non-compounded substances. My next choice would be something that is not FDA approved for us. It's compounded estradiol, and they can be mixed with your progesterone and taken under the tongue or vaginally, and it's a much better outcome, and you'll feel so much better. It's what Suzanne Summers had in her book, and she's right. It is better to take hormones non-orally. However, she took drops 6 or 8 times a day, and since that's impractical for most of us, I'm not sure I go to the bathroom that many times a day, I don't have someone following me around to give me my hormones, I'm looking for something that's easy. So sublingual and vaginal tablets are once or twice a day. They're easier, and they're much healthier for you. If you have that choice, I would suggest that. Now, if we're going to talk about the best form of hormone, and if you do need testosterone, then my feeling of for the best form of hormone is totally non-oral and something you only have to dose every 4 to 6 months. And those are hormone pellets, which was the only thing that made me better when my ovaries were removed. And I became an expert in it because no one in my city was an expert in it. So the man who treated me, Gino DeTerra, became my mentor. And then I went to him to be trained. He then trained me in using estradiol and testosterone pellets, along with a progesterone of some type, sublingual, or even there's a new IUD called Mirena that has progesterone in it that stops bleeding and stops all forms of accumulation of uterine lining. So you don't have periods, and it's easy. That would probably be the easiest thing, have a Mirena or a hysterectomy if you have one, and then take the hormone pellets that have testosterone and estradiol in them, because it's easy, it's every 4 months, you don't have to think about it every day. It's like having your ovary back, at least it was for me, and it's much more physiologic. So that would be my choice. Now, other forms of testosterone, if you choose to use the sublingual estrogens and progesterones, or even if you're using a patch, the other forms would be to use a testosterone mixed in either a Duragel, which is compounded at your pharmacy, and that's used nightly, or a testosterone that's in Vaseline that you can put around the thighs, and that will be absorbed and not make any other part of your body hairy, because you may grow hair where you apply it. So those are the ways to take testosterone if you do in fact need that. That is what supplies us with libido, self-esteem, getting our muscle mass back, getting our energy back, and it brings us into stage 4 sleep. Now, if you don't have good sleep and it started in the early 40s, or if you started having migraines in your early 40s, that is a lack of testosterone. And then you do need some form of testosterone to make you feel normal. Because what we're really going for here is not to be younger or to be a movie star or someone we're not. We're to be ourselves. We want to have our brain back. Some women come into me and say, I've lost myself. I don't know who I am anymore. My husband doesn't know who I am anymore. He's going to throw me out. Or he wants to walk away from me because he's like, who inhabited your body? Kind of like we think of our teenagers when they go through their first part of adolescence. Who are you and where did you come from? That's what they're thinking about us. And we need to fix that if we have a severe case of that, because it takes a toll on our marriages. It takes a toll on our spirits. It takes a toll on our self-esteem and who we are. In those ways, we absolutely positively have to get ourselves back. I think that is in God's will. I don't feel that that would be outside of His will to get ourselves back. And I believe that He has things for us to do. And those things require that we feel good and that we're healthy and we can take care of our husbands and our children, and that we can live a long time being His witness. So in this way, I believe that hormone therapy fits into the grand plan that God has for us.